Welcome, everybody. We're going to go ahead and get started with today's session. I know people are still hopping on, but want to welcome everybody to today's webinar, Leveraging Federal COVID Relief Funding to Support Student and Staff Wellbeing and Connection, Opportunities for State Education Agencies. We're excited you all could join us and really hope that you enjoy today's session. My name is Alex Mays, and I'm the National Program Director at Healthy Schools Campaign. Healthy Schools Campaign is co-hosting today's webinar with the Council for Chief State School Officers and the National Center for School Mental Health. So it's been a wonderful partnership and appreciate them co-hosting today's session with us. So next slide, just a few logistics for our session together today. Our webinar is going to run for an hour, and we will be recording today's session, sharing that recording along with the slides from today in an email that will go out to everyone early next week. We're also going to save the last 15 minutes or so of the webinar for a question and answer session with our panelists. So feel free to send in those questions at any point throughout the webinar using the questions box on your control panel, and we'll be sure to get to them during the Q&A session at the end. Next slide. So our webinar today, as the title implies, is really going to dig in around the historic opportunity that has been presented to state education agencies and school districts through COVID relief funding. And we're really going to focus today on how that funding can be utilized to support student and staff mental health and well-being and connection, which we know are critical needs as students and staffs return to in-person learning. So we'll walk through the available funding streams and the timeline for utilizing those, talk about some concrete ways in which those funds can be used to support student and staff mental health and wellness. I will also be speaking to ways in which we can access sustainable funding streams to continue the efforts initiated with the COVID relief funding. And then we are thrilled today to have two speakers from the Michigan Department of Education, Superintendent Rice and Deputy Superintendent Grant, joining us to tell us more about what this work has looked like in Michigan. Next slide. So just to ground us all before we dig into the nuts and bolts of the COVID relief funding, we know that in the context of the tremendous stress, loss, and community and family burden of the last year and a half, it's not surprising that we would see an impact on young people's mental health. We know that these impacts cut across all communities, and maybe most impacting communities hit hardest by COVID, including our communities of color and those with inequitable access to healthcare and education. We do now have some data indicating that young people are in fact experiencing negative mental health impacts. For example, emergency department visits for mental health concerns are up for children and adolescents, and about a quarter of parents report that their child's mental health is worse than before the pandemic. We know that these issues are not new, that mental health and wellness issues have been impacting students' health and their ability to learn for years. And we also know that these experiences aren't over, that the impact of the pandemic on development is going to have a lasting impact for years to come. And so we really think it's imperative to think about how we can be intentional about addressing these needs now and into the future, and really thinking about how to utilize COVID relief funding to do that work and address those needs. Next slide. We also know that it's not just our students that are impacted by this. COVID-19 has significantly impacted staff mental health as well. And so today we really want to talk about how this COVID relief funding can be used to support staff mental health too. In a survey conducted last summer by the National Board of Professional Teaching Standards, it found that the vast majority of teachers reported working longer hours following school building closures, and only 28% said that their school offered adequate support for school mental health. This is particularly important when it comes to teacher retention. Last August, a national survey found that 1 in 3 teachers indicated the pandemic had made them more likely to leave teaching. So in addition, certainly to wanting to make sure that our school staff feel supported and are safe and healthy, there's also good data that demonstrates that when teachers' mental health suffers, so does that of their students. And so again, we want to make sure that we're thinking about how to support the well-being, connection, and mental health of students and staffs across the country as schools reopen this fall. Next slide. So along those lines, Healthy Schools Campaign, Council for Two State School Officers, and National Center for School Mental Health teamed up, and we issued guidance last month that goes into a lot of detail about ways in which COVID relief funding can be used to support student and staff well-being and connection. We'll talk a lot more about some of the content that's in that guide, but it's a fantastic resource for folks who are really interested in digging more into this content. So next slide. With that, I want to get into our content. We have a fantastic lineup of speakers. We are thrilled today to have Peter Zamora from the Council for Two State School Officers, who's going to be kicking us off with an overview of COVID relief funding. And I'll give a quick overview of some of the concrete ways in which this funding can be used. And then again, we'll have our colleagues from the Michigan Department of Education sharing more about what this has looked like within the state. So Peter is going to kick things off. He's the Director of Federal Relations at the Council for Two State School Officers. And in that work, he represents state superintendents of education in K-12 education policy matters before Congress and the Department of Education. He's been an incredible partner in this work and is just so knowledgeable about these issues. So we're thrilled to have him here today. So Peter, I will hand it over to you to just ground us all in what the opportunity is at hand with COVID relief funding.
Thank you very much, Alex, and just really appreciate the opportunity to be here today and the opportunity to coordinate with Healthy Schools Campaign. You know, we had coordinated previous to the pandemic, of course, but this work has never really been more important. And so thank you for your work and for the opportunity to coordinate. I was asked to do just a very brief kind of introduction. The guidance that Alex referenced, and I believe my colleague Ann Bowles also posted in the chat, is going to have a lot more information, but I was asked just to do a sort of quick little level setting as to what the primary sort of COVID relief dollars are. But you know, as the pandemic really began to manifest itself, you know, last winter and spring, it became apparent to us here doing federal work that federal investment was going to be necessary to help to alleviate the effects of COVID-19 upon, you know, kids in their communities. So we have sort of mounted a national advocacy campaign in coordination with a lot of our national partners, the Governors Association, the state legislators, teachers unions, and others, and have secured substantial, really unprecedented federal resources. They were approved in sort of 3 different pieces of legislation, but they all sort of generally track the same kind of structure. And again, the report that is linked to in the chat has a lot more information. But we basically sort of created this structure in Congress that has persisted. So about 90% of the almost $200 billion approved under the Elementary and Secondary Schools Emergency Relief Fund, 90% goes down to the district level, 10% is held back at the state. There are some specific reservations in the American Rescue Plan, the most recent tranche of these funds, and I'll have a chart here in a minute where we can sort of dig in a little bit further, but this most recent tranche does have some specific state set-asides for learning recovery, for evidence-based after-school and summer enrichment programs. But as we look throughout, this is really the most substantial federal investment we've seen in some time, if not ever. And then also it has express really dedicated focus on student health and wellness that many federal education statutes do not. So there's specific authority to implement public health protocols, specific authority to provide mental health services. But then really, and I think as we'll hear from our colleagues in Michigan here, states and districts have really been sort of taking these resources and providing sort of critical relief activities sort of throughout. And so this structure is allowing this work to really take off at the state and local levels. I can include the link here in the chat when I'm off, but the US Department of Education has also been overseeing these funds in a very expansive way and has really leaned in on the student health and wellness components and staff health and wellness for that matter. And so they did release a frequently asked questions document back in May that's very specific around how these funds can be used in these different sort of categories. And again, I'll include that here in the chat here momentarily. But if we go to just one more slide before I get out of the way. So again, I kind of referenced that there's 3 different tranches. The first was approved last March, and that will the obligation deadline. So basically the period under which folks can make commitments with these funds will expire on September the 30th of 2022 for the first tranche of funds. That was under the CARES Act. That was about $13 billion nationally, a little bit more. And then states and districts have just a few months after that to liquidate those funds. And then as you look at the subsequent tranches of funds, the coronavirus relief bill that was passed back in December, that had about 54 billion, a little bit more. That's available through September 30th, the end of the fiscal year in 2023. And then the most substantial of the 3, or the largest of the 3 different pools of funds, was under the American Rescue Plan that was approved this year, this March, and that's about $122 billion. And again, this third tranche is 1 year later for that period of availability. So, taken as a whole, we're seeing a substantial federal investment, in academic recovery and also in recovery on student health and wellness. And so, now the work is underway in states and districts across the country. And so there's fabulous work that's underway right now. So it's a real pleasure at CCSSO to support states in this moment in time as they're doing heroic work, and also to coordinate with Healthy Schools Campaign and others around how we provide national support. So I'll be glad to be a resource during the Q&A, but I think I'll kick it back to you, Alex. Thank you.
Great. Thank you so much, Peter, for that overview. It's incredibly helpful just to have the lay of the land and really the historic opportunity at hand. So next slide, I'm now going to dig in a little more around some of the concrete opportunities and ways in which the funding that Peter just walked through can be highlighted and utilized for health and wellness activities, and particularly supporting student and staff mental health and well-being and connection. Next slide. So again, just this funding to state education agencies and school districts represents a historic opportunity to support this work. We know that there are a wide range of needs that can and should be addressed with these COVID relief funds. And it's really critical, though, we think that states and school districts invest these resources in efforts that support student and staff mental health and well-being and connection. Just really given the data that I shared earlier about how these needs are increasing and present more so than ever. Next slide. So when the guidance that we developed just provides a number of examples of allowable uses of COVID relief funds for both state education agencies and school districts that support student and staff well-being and connection. I just want to walk through a handful of those examples. By no means is this going to be exhaustive. I think the main message we've been trying to convey is that there's a lot of flexibility around how these funds can be used. But that really there's an important need to think about how the funds can be used to support capacity building and infrastructure, just with an eye towards practices that are sustainable and can be continued in the long run to support this work after COVID relief funds are spent. So, Peter shared that state education agencies keep 10% of the funds. So I really want to just take a moment to highlight some allowable ways in which state education agencies could use that fund to support mental health and wellness. We categorize these in kind of 6 broad categories, and just want to walk through an example of each of these to kind of give a flavor for the types of activities that could be supported with these dollars. So the first bucket is understanding the policy environment. So states could use this funding, for example, to do a scan of their state level legislation of policies that are inclusive of mental health, equity, trauma-informed practices, school climate and culture. And they could do this through, studying their own state, but also using the funds to really do an analysis of what's happening in other states and ways in which they could build upon their own work. We also highlight utilizing these funds to foster meaningful collaboration. We just feel there's a lot of incredible collaboration that's been developed over the last 1.5 years as a result of COVID. And there's just such a need to continue that work, to do this work in partnership with families, youth, community partners, and really establishing more broadly cross-sector collaborations with key partner agencies like Medicaid, public health, human services, healthcare, and more. So this funding can be used to support that work at the state level. Some nice examples: Illinois has the Illinois Children's Mental Health Partnership. Virginia has a partnership for school mental health. Those are efforts that have been in existence for a while, but those are the types of things that could be supported with this funding. That funding could be used to convene that statewide effort, support the facilitation for it, and really with an eye towards sustaining that work after this funding is spent, to continue those efforts. We also highlight using this funding to strengthen and expand school Medicaid programs. And I'm actually going to come back to that and speak a lot more about that, because we see that as a really critical opportunity for supporting mental health and wellness in schools, but also tapping into a sustainable source of funding to continue this work after COVID relief funding is spent. There's also an opportunity to use this funding at the state level to promote implementation of multi-tiered systems of support. That could be done through establishing a statewide strategic plan or framework around comprehensive school mental health. Wisconsin and Colorado have really wonderful examples of this. It could be done, the funding could be used to put out guidance to school districts on how to do this work and implement multi-tiered systems of support. And it can also be used to do statewide efforts such as enhancing state standards around including social and emotional learning and mental health literacy in the curriculum. Another key area, and we're actually starting to see a lot of states and school districts use the funding to do this work, is enhancing data systems and collection. Again, this is a perfect example of kind of how those funds can be invested in infrastructure that can in the long run support mental health and wellness within schools. So that could include providing guidance to school districts on how to conduct universal screenings or wellbeing check-ins, or it could be used to actually build the structures to integrate mental health or school climate data into state reporting and accountability systems. So a lot of opportunity there. And finally, states can use these funds to build school district capacity, which we know is another critical need. That could include hiring staff within your state education agency to provide technical assistance and support to school districts on school mental health. It could include issuing guidance, documents, and resources to support this work. And it could also include issuing grants to school districts to really dig in and pilot best practices and think about how to do this work at the local level. So a lot of opportunity for using that set aside that states have to support this work. Next slide. And there's also a tremendous opportunity around using this funding at the school district level and recognizing that 90% of the funding does go down to the school districts. This is where we're going to see a lot of this work done and the funding utilized. I will say, again, across the board, we've really tried to emphasize how these funds can be used to do capacity building, infrastructure development. With that being said, we know that there's a huge need and interest in utilizing these funds to hire full-time employees, to hire staff to support this work. That's certainly an allowable use of the funds. We've just sort of been providing the note of caution that, you know, this is one-time funding. And so really encouraging districts to think about where sustainable funding can be leveraged to support those staffing positions in the long run, or thinking about utilizing the funds to hire contract labor or offer stipends for current staff or contract with appropriate agencies or partners to do this work. So just, I think, an important note as states and school districts are thinking about investing these funds. So in terms of the school district allowable uses, we've been thinking about using the funds across multi-tiered systems of support and highlighting examples across tiers 1, 2, and 3. So just some examples of ways in which this funds can be used to support tier 1 activities. It could be used to support and to hire someone at the district level that could oversee district wellness or social and emotional learning, to provide technical assistance and direct support to schools around this work, to do asset mapping to really understand where there are strengths within the district around mental health and wellness, where there are opportunities for improvement. Districts can also use the funding to build or enhance data systems to include mental health data, which is a key need. And again, something we're increasingly hearing school districts using these funds for. So that could include having data and systems that can include mental health screening data, triage systems, et cetera. And then definitely the funds can be used to support staff professional development around mental health and wellness, as well as other needs. So another important use of those funds. And then for tiers 2 and 3, the funds can be used for things like mentoring programs, brief interventions for school clinicians, building systems like referral and reentry systems and crisis preparedness programming, as well as I mentioned earlier, hiring those staff to support the direct delivery of services. So a lot of opportunity in terms of how these funds can be used to support this work. Next slide. So I just wanted to take a moment, since one of the key questions we get asked again and again in this work is recognizing that this funding is one-time funding. And so recognizing that, we really want to highlight where there can be opportunities for sustainably funding efforts initiated with COVID relief funding. And as states and school districts are thinking about how to spend these funds, we're encouraging them to do so with an eye towards where there might be funding streams that can be tapped into in the long run. So this is not an exhaustive list, but just to highlight that there are a number of funding streams available that can be used by states, by school districts, to support ongoing delivery of programs and services and supports related to mental health and well-being and connection for students and staff. The Every Student Succeeds Act title funding is funding for all K-12 public education, which has a lot of flexibility in terms of how that funding can be used to support health and wellness within schools. Medicaid is a key source of funding for schools and can play a really important role in terms of supporting delivery of health services. I'll say more about that in a moment. Individuals with Disabilities in Education Act, federal grant programs, as well as certainly looking at opportunities through state and local funding and community partnerships. So I just highlight that to underscore that there are ways in which funding can be sustained to ensure that these efforts don't have to go away once the COVID relief funding is spent. Next slide. I want to just take a moment in the last 5 minutes or so here to speak about school Medicaid, because we see this as a really important way in which states and school districts can be spending these COVID relief fundings to strengthen their school Medicaid programs and ultimately draw down increased federal resources to support this work in the long run. Medicaid has a long history of paying for health services delivered within schools, and it's a key source of funding for schools across the country. But it's largely untapped by a lot of states, especially when we think about the delivery of mental health services and supports. So we really wanted to just highlight it today because I think it's an excellent example of thinking about how to invest COVID relief fundings to strengthen a program like school Medicaid that can ultimately lead to accessing additional dollars to support this work in the long run. So historically, school Medicaid has really just paid for services that are included in students' individualized education programs. So those are more of your speech therapy, occupational therapy, physical therapy services, less so of your mental and behavioral health services. Next slide. But a policy change in 2014 actually creates a tremendous opportunity for states to expand their school Medicaid programs. The policy change essentially just allows states to permit school districts to bill Medicaid for any Medicaid eligible service delivered to any Medicaid enrolled child. So no longer limiting Medicaid reimbursement to those services included in students' individualized education programs or more of your special ed services. So this creates a huge opportunity, especially when we think about mental health services for students and who are enrolled in Medicaid. States have to make the decision to move forward with this, even though the federal policy change happened. Many states have to submit a change request called a state plan amendment to Centers for Medicare and Medicaid Services, which oversees state Medicaid programs. But that's something that happens regularly. It's by no means an insurmountable barrier, but states do have to make the decision to move forward with this. Next slide. This map just highlights the states that have done this so far. There are 15 states that have utilized this opportunity to expand their school Medicaid program. There are a number of other states that are in the process of doing so. So still a lot of work to be done, but a lot of opportunity. Next slide. And so I highlight this because I think it's just a really important opportunity. If you are in one of those green states that has expanded, these COVID relief fundings can be a perfect way to strengthen implementation of that expansion, to support school districts in doing this work. And that can lead to significantly more federal Medicaid revenue coming into your states and school districts that can then in turn support the efforts that were initiated with these COVID relief dollars. If you're in one of those states that's not green, these funds can certainly be used to support your state in expanding its school Medicaid program beyond IEP services. So just to highlight some of the direct ways in which the COVID relief funding can be used to strengthen school Medicaid, certainly at the state and the local level, it can be used to invest in staffing and supports that are needed to expand the program and do this work. We do it to the extent that districts are utilizing the funds to hire additional school staff to support delivery of services. We really encourage them to think about hiring the staff that are Medicaid eligible, so that ultimately those their time and the services that they're delivering can be billed to Medicaid. The funds can be used to develop and implement guidance around school Medicaid, to hire designated staff members at the state level, at the district level, to oversee this work and support school-based Medicaid to really strengthen the program. And certainly to invest in longstanding infrastructure projects like telehealth, electronic health record systems, things that will be in place long after COVID relief funding is spent, that can really go a long way in terms of supporting ongoing delivery of mental health services to students. And then the funds can also be used to provide grants to school districts who are interested in potentially piloting school Medicaid programs that aren't currently involved, or piloting best practices around this work. So just wanted to underscore that as a really key opportunity we see for states and school districts to invest these funds with an eye towards drawing down additional funding. So with that, we will now, I think we're going to hand it over to our colleagues in Michigan, who are going to share more about the incredible work that they've been leading within the Michigan Department of Education to support mental health and wellness. So I will introduce them and then they'll get their slides up. We'll have them come on video. There they are, fantastic. So we're thrilled today to be joined by Superintendent Michael Rice, who was appointed Michigan's 44th Superintendent of Public Instruction in May 2019. He came to the Michigan Department of Education after serving 17 years as a local district superintendent, most recently in Kalamazoo Public Schools, where he started full-day pre-K, quintupled the number of full-day kindergarten students, and led the improvement of student achievement in reading, writing, and math. We're thrilled to have him here. We are also joined by Deputy Superintendent Kyle Goran, who oversees finance and operations for the Michigan Department of Education. He is an incredible leader and advocate in youth health development and safety issues across the board. And in his current role as Deputy Superintendent of Finance and Operations, he provides leadership over a diverse spectrum, ranging from financial management and school finance to health and nutrition services, and the Library of Michigan. So we're thrilled to have you both here today. I will hand the virtual floor over to you now to share more about what has been happening in Michigan.
Thank you, Alex. Good afternoon, everyone. I want to thank CCSSO, the Healthy Schools Campaign, and the National Center for School Mental Health for the partnership and the invitation to speak with you today. We're going to be relatively brief. I'm going to move through a slide. Kyle's going to move through a more complicated slide, and then he'll turn it back to me for the EASY. We have a division of responsibility in the Michigan Department of Education. I handle the EASY. Kyle handles the more complicated. To the next slide. So we have a number of expressions of commitment to support children's mental health in our state. Our top 10 strategic education plan includes a goal that explicitly raises up the health, safety, and wellness of all learners. We began in the midst of a pandemic, a statewide social and emotional learning / children's mental health network. We view SEL as good tier 1 children's mental health work. We have a free online SEL professional development opportunity or set of opportunities for educators. We have the Michigan Health Endowment Fund partnership, which permits us to work with approximately 20 local school districts, building up their efforts and their work in SEL. We've got a student mental health summit that we're going to have in early October, statewide SEL conference in late October. And then finally, we're part of an AASA SEL cohort. We believe strongly that this is an important area. It's been largely overlooked relative to need over the last several years. And Kyle's going to share with you just how overlooked that has been. When I came into the department in 2019, we had just begun funding children's mental health explicitly from the state level in the state of Michigan. And we've come a long way in the last 2.5 years, come a long way in the last half decade as well. So Kyle, to the next slide.
Sure, thank you, Dr. Rice. And with those expressions of commitment, to actualize those, we also need investments to realize their full potential. So as Dr. Rice mentioned, from a state perspective, we've had recent state investments in our State School Aid Act in a couple different sections. The first bullet there, you see section 31N6 provides resources to our intermediate, all 56 of our intermediate school districts to support the hiring of mental health professionals to provide services to students in the region. The section 31N5 also provides resources to our network of child and adolescent health centers that we partner with our state health department, the Michigan Department of Health and Human Services, and it provides licensed master's level behavioral health providers in schools that do not currently have those services available to their general education students. In total, 68 additional centers have been strategically placed in counties in our state that were home to more than 2/3 of the youth suicides from 2008 to 2017. New this year, in the budget that was signed by our governor in early July, section 31O provides resources to districts with the greatest need for school psychologists, social workers, counselors, and nurses. This cost share model provides funding to staff hired under this section at 100% for the first year, 66% for the second year, 33% for the third year, and requires the recipient district to fully fund staff after 3 years of funding. As Alex mentioned earlier, Michigan was one of the early adopters to take advantage of the change in Medicaid policy. Our term for our program is Caring for Students, or C4S. Is an expansion of our existing school services program that provides services to Medicaid eligible general education students. At the time when our waiver was approved, C4S increased the number of eligible beneficiaries in our state from 108,000 Medicaid eligible special education students to 980,000 Medicaid eligible students statewide. The above dedicated funding streams and Medicaid match strategy to support school-based mental health services for students did not exist just 3 years ago, as Dr. Rice mentioned. So Michigan has been late to the game in terms of funding this priority, which is very important, especially to Dr. Rice. And as we have gained his leadership and focus on this area, we've been fortunate to have resources at a state level match that intensity and urgency. To continue to raise consciousness about the need for mental health services for children, utilizing the SCA Reserve Authority provided in ESSER, MD established the Education Equity Fund that permitted eligible high-needs school districts the opportunity to apply for up to $37 million to support children's mental health services and to narrow the digital divide. As you can see on the slide, 7.65 million of that, of the 37 million was applied for by districts specifically for children's mental health. And as Alex mentioned earlier, the total of our Michigan's 3 ESSER allocations is 5.8 billion, of which 90% are allocated to LEA. So the majority of the resources, again, are in the hands of districts to make decisions about supporting this work. Additionally, MD has made BH Works, a comprehensive behavioral health software platform, available for free to all ISDs and school-based mental health providers statewide. BH Works assists service providers with universal screening, treatment, and care coordination to improve student mental health outcomes. Engaging the philanthropic community is key. MD applied for and was awarded a 2-year, $500,000 grant for the Michigan Health Endowment Fund to continue to develop our statewide systemic social emotional learning. These resources will support a community of practice with 19 rural, urban, and suburban school districts and provide SEL-related professional development for Michigan educators. Dr. Rice?
Thank you, Kyle. I'd just like to mention three sort of current and future challenges for us. The first is growing the mental health profession talent pipeline. You know, the great news is we've got all these dollars that have been cited by Kyle, by Peter, by Alex. The challenge, though, is to actually be able to purchase staff members on an enduring basis to fund the needs of our young people. We simply don't have in the state of Michigan and in many places across the country the requisite nurses and counselors and social workers and school psychologists to do the work. So it's not simply a function of you know, build it and they will come, fund it, and all of a sudden you have mental health supports for our young people. We continue to grow the consciousness, number one, and we have to grow the mental health profession, number two. It's not as simple as, you know, when I have an issue around the house, I go to Lowe's or Menards or Home Depot and I buy something off the shelf. You simply can't do that with social workers and school psychologists, nurses, and counselors and other mental health professionals. So this is really important that we develop this field with Grow Your Own for support staff, Grow Your Own for students. Grow Your Own for students is a long game. Grow Your Own for support staff, a somewhat shorter game. You take an individual who may be a behavior specialist in a school, maybe a BSW, and convert him or her or encourage him or her to get the requisite credentials to become an MSW in your school district, for example. So there's this whole effort that we have to create, not only to generate funding, generate consciousness, number one, funding, number two, but also that talent pipeline, number three. So that's one. Two, there's an issue of the cliff that as a number of people have shared, the ARP dollars end with the Tidings Amendment, September 30th, 2024. And so we have somewhat of a financial cliff thereafter. We are working within the state to develop other resources for that inevitable moment. But in addition to that, we have to realize that what we do today serves as an audition for what we're able to do tomorrow. What I mean by that is that if we're able to serve children better in the next 3 years, with the CARES Act dollars, with the CRESA dollars, with the ARP dollars, with whatever embellishments in state revenue come from the injection of those federal revenues into our state, we're going to be better served post September 30th, 2024. We are in some ways auditioning in the next 3 years for greater resources. What we're saying to local school superintendents and principals and teachers is, if we can demonstrate what we're able to provide for young people in terms of academic and social and emotional support for them next 3 years, if we're able to show the value of this funding in the next 3 years, we make a case for the expansion or the embellishment of state funding to address that cliff issue come September 30th, 2024. As the expression goes, that's our story and we're sticking to it. Thank you.
Fantastic. Thank you so much, Superintendent Rice and Deputy Superintendent Grant. We really appreciate you taking the time to share the incredible work you're leading in Michigan. So we will now transition to the Q&A portion of our webinar. Peter, I'll invite you to be brave and come back on video. So please, participants, send in your questions. We have a number that have come in. Please continue to do so, and we will move forward with asking those of our panelists. So the first question I have is for Kyle and Dr. Rice, wanting to know, just given kind of the incredible work you highlighted and specifically what you're doing around utilization of the COVID relief funding, could you speak a little bit about how you engage stakeholders in the process of determining how to invest these funds? You know, just a little bit more around, I think, the process in general. What did that look like? How did you decide how to spend these funds? Was there input from districts, from the community, et cetera?
Sure. So a couple things. One, in Michigan, but for the CARES Act, the SEA reserve was distributed within legislative appropriations. So the SEA reserve was in a fashion a non-SEA reserve in Michigan for ESSER 2 and ESSER 3. So that's one thing. What we've done is we have consistently drumbeaten around particular, to mix metaphors, gifts that keep on giving. In other words, we've said, you have the money, local school districts. This is very different from what typically is the case. Typically, you know, the dollars flow from the state, and we say, if you want to access the dollars, you have to do A, B, C, D, and E. Not the case with respect to federal pandemic relief funds. The dollars in the local school districts, we are left to exhort. We are left to use the bully pulpit, if you will. And we've pushed these 7 gifts that keep on giving. Early childhood, number 1, early literacy, number 2, health, safety, and wellness, number 3, the teacher shortage, number 4, the digital divide, number 5, the importance of time, number 6. Kids have foregone it, they need to make it up. And then the effort to address secondary school programming in a more substantial way. And I'm not talking about traditional secondary school programming, I'm talking about embellished secondary school programming. I'm talking about transition services for special needs children. I'm talking about AP, IB, early middle college, dual enrollment, and so on and so forth. So these are the areas that we've pushed, because what we want to do is we really want to develop a strong foundation consistent with our state strategic education plan. It's the bully pulpit, Alex. I mean, that's where we are. What we've said is these are areas you do better by kids early. You do better by kids later. You know, all the early is upstream and everything else flows downstream. And we would add that health, safety, and wellness, particularly children's mental health, is very much similar to that.
Thank you for that. That was very helpful. Appreciate you sharing. Next question is, again, for both of you, about the workforce shortage. And I know that is an issue that comes up again and again, particularly when we think about mental health professionals. So we've had a couple people ask if there's any additional details you might be able to share around how you're working to address the talent pipeline for mental health professionals. Particularly, there's interest in rural areas, but I think just in general, if there's any additional details you can share regarding how you're thinking about addressing that challenge.
So 2 pools of Grow Your Own. The first associated with students, the second associated with support staff. Obviously, the latter is more immediately accessible than is the former support staff. Remember, support staff members are already in your schools. They have great relationships in many cases with young people. And the question becomes, are you today what you are immutably capable of being tomorrow? And of course, the answer is no. Everybody on this line at some point wasn't what they were and became what they were. People poured into them, they believed in them. And as a result, every one of us became something more than we had been at a given moment in time. And we need to do that with support staff members. I'm reminded of a great bus driver we had in my former district, Tony Spencer. And, we poured into him. He's an elementary school teacher. I'm reminded of the second shift custodian in Clifton, New Jersey, in the administration building, Taras, who was a Ukrainian immigrant, who's now a teacher. You aren't who you are. You aren't what you are at a given moment. You aren't what you do at a given moment. You're what you're capable of becoming at a given moment with the support of others, your vision, your dream, but with the supports of others. And so, we're encouraging people to tap into their support staffs, tap into people in their communities that already have these great relationships with children, which permit them to be great in other or related helping fields as well. We are going to dig deeply into this in the fall with the $240 million appropriation that Deputy Superintendent Goran mentioned during his presentation. We're going to really work to help our local school districts develop these pools with our universities across the state. And Kyle, you're a social worker by training, so talk to us.
Well, I think Dr. Rice hit the nail on the head. I think one thing I would add, especially I see in the chat, the questions kind of focused on rural areas. In much of our state, not only has there been a lack of opportunity to have these positions in schools on a broad basis, so many districts have turned to partnerships and relationships with their hospital systems or their local health departments, as they are more attuned to having those type of staff already, in their workforce, and essentially transitioning, serving, in this case, students, instead of serving them in homes or at the health department, kind of repositioning them in schools to provide those services. So especially in some of our more rural counties in our state, those relationships have been key to identifying staff to provide those services in school. Again, still not where it needs to be, and there's still a shortage, documented provider shortage in our state in many areas, not only on the behavioral health, but on the physical health side of things as well. So lots of work to do, but again, partnerships with health systems have been a way to address that in our state.
That's fantastic. And that's a really interesting example and strategy for addressing the shortage. Thanks for sharing that. So we have a couple of questions digging in more around staff wellness and recognizing the critical needs of supporting staff, mental health and wellness too. So wanting to know, what approaches are districts taking with relief funds beyond just encouraging self-care to support staff wellness. I don't know, maybe Peter, I know this has come up kind of in some calls you've had with CCSSO, Superintendent Rice, Deputy Superintendent Goran. If this has been an issue in Michigan, would love to hear more. I can also share a little bit from Healthy Schools Campaign, but I think collectively, if people could reflect on where there are opportunities for staff wellness, that would be very helpful.
Go ahead, Peter.
Well, I'm happy to speak sort of very briefly from the federal level, sort of noting that there has, and it's been sort of a remarkable transformation in the sort of education arena here in DC, much more recognition of sort of whole child supports, sort of the role of the school community in education, the role of school facilities. There's been a lot of discussion around safe school facilities, but then also on the sort of educator health and wellness components as well. So I've both seen a focus at the U.S. Department of Education, where the Secretary of Education, of course, is a former state chief and a district and a teacher. So he, I think, brings that with him to the role, but also the Center for Disease Control. We've hosted multiple webinars for state audiences where we've sort of had them present some resources. So I can, follow up to provide some additional links, but I just have seen a real transition in the debate around education here at the federal level to encompass this kind of broader, and as a former teacher myself, it feels like a sort of course correction that's long overdue and may yield some additional sort of positive policy directions here at the federal level.
So at the local and the state level, I think there's an increased awareness that our adults in helping professions are themselves vulnerable or themselves fragile and require care. There are employee assistance programs. There are support circles that local school district teachers are engaged in or involved in. I think there's an understanding that we need to do a better job of bringing people into the profession and then supporting them within the profession. I think we have long-standing challenges around mentoring people in our profession at all levels. I'm talking about not simply teachers, but principals, new or veteran. I'm talking about superintendents, new or veteran. And I'm talking about board members, new or veteran. But particularly when you're new in your profession, those are critical, that first year or years, those are really, really important. And we do well to support our people better. We in the Michigan Department of Education are looking at state laws which would require the mentoring and professional development of new board members, new superintendents, new principals, and new teachers. Currently in our state, only one of the four is required, and that's the mentoring for teachers. And it is inadequate, to say the least. And what you end up having is you have a lot of churn, a lot of revolving in the profession that serves nobody. Most of us remember our first year or a couple of years, but particularly our first year in any part of this profession. It tends to be a very difficult experience. Kyle, do you have more to share on that?
Sorry, trying to get off mute, Dr. Rice. No, I do not. Thank you.
Okay.
And Anne, did you want to jump in and comment on CCSSOs End?
Sure. Thanks, Alex. It was wonderful working with you all on this guide. One thing that we've learned from our conversations with states, which just builds on what Peter said, is that there's just a greater recognition from USED about the importance of valuing staff well-being as well. So we've seen districts doing things on the physical infrastructure side in terms of something as simple as your staff lounge, for example. But then we've also seen districts providing, for example, like reimbursements for wellness activities. And I think one thing that I would underscore is ask your staff, right? What would they really benefit from, and have them help think through what would be really helpful in terms of relieving stress, because the point here that really aligns with the key priorities from USED is that stress on staff really leads to them leaving the profession. And so what can be done to help really ensure you retain staff, and that's a priority for these dollars. And I think including them in those conversations about what you can do would be really helpful.
Great, thank you so much. That's really helpful, and some nice concrete examples there as well. I think we have time, just one last question. I know we've been hearing from a lot of states just that there has been a lot of cross-agency collaboration at the state and local level over the last year and a half. And I think we know that's really critical, especially when it comes to student, staff, and well-being moving forward. I'm wondering, Dr. Rice and Kyle, if you could speak a little bit, to what cross-agency collaboration has looked like in Michigan, if you see that moving forward. And Peter, maybe, I don't know if you have thoughts from the national perspective of how you're seeing your members work with other agencies, what those partnerships look like, and if you see them extending beyond the public health emergency.
Sure. So we have extensive partnerships with a range of agencies, state agencies within the state of Michigan. Kyle's been intimately involved in the partnership with MDHHS, and I'd like him to describe that if he would, please.
Sure. Thank you, Dr. Rice. I'll just say that these partnerships existed, pre-pandemic, and may have been more programmatically focused. I mentioned the Child and Adolescent Health Center program that we jointly run earlier in the presentation. I think the pandemic has only served to highlight and reinforce the need to have agencies partner. And from a school's perspective, the way COVID has played out in Michigan, there's a better understanding of the school environment and how things play out in a school when you involve the state education agency. And so I think both sides see value in getting kind of other perspectives of kind of they're just different worlds at times. And so I think we benefited from being able to have those conversations as it's played out specifically in the pandemic. And from our perspective, as we've had to deal with, health mandates and otherwise, they're the experts in that realm. And so, it was helpful for us to be able to rely on their expertise and to be able to jointly communicate that to schools. So again, I think the pandemic has only kind of deepened those partnership roots that were existing before.
And I think that's consistent, really. I think every state, we've sort of strengthened relationships between state education departments and state health departments. And, particularly in the early days of the pandemic, we had to kind of build structures and, analyze the science, and it was all kind of happening, in real time. And so I think, again, heroic work has happened in states, to kind of build these structures. And I really like Michael's description around this is, what do we do with these structures once we've created this? This is kind of an audition for, a new approach to education, or maybe not a wholly new approach, but an additional kind of increased focus. And so, yeah, we've been glad to sort of facilitate conversations. We often do bring, state chiefs with their counterparts and agencies to speak to other state chiefs around kind of how to build these relationships. But honestly, I think we're learning a lot from states around how to do this. And I will also kind of note, from my perch at the federal level, that we're seeing better coordination between federal agencies than we've really ever seen. So regular coordination between CDC and the Department of Education in particular. And, we at CCSSO have built relationships with CDC and have hosted a number of different conversations between CDC and state educational agencies. And so again, I look forward to building on those relationships and, both sort of deal with the short-term pandemic emergency and the sort of ever-shifting, course there, but then also, how do we build on these structures? There were, pre-existing deficits around, health and academic opportunity. So how do we, again, as sort of Michael described, use this as an audition to build structures that really deserve to persist moving forward. So really appreciate the conversation today, the sort of ongoing partnership with Alex and your team, and look forward to kind of what the next steps in this process are.
Great. Thank you so much, Peter. And a huge thank you again to Dr. Rice and Kyle for joining us. On that note, we are going to wrap things up. So again, we will be sharing a recording and the slides from the webinar with everybody. Just encourage everyone once again to check out the guidance on how to utilize COVID relief funding to support mental health and wellness. And on behalf of Healthy Schools Campaign, again, a huge thank you to Council for Chief State School Officers and National Center for School Mental Health for their partnership in this work. So thank you, everybody. Enjoy the rest of your day. Bye.